Hey friends, welcome to Vet Visit. I'm Hansika Singh. I'm a veterinary student and I vlog about veterinary and pet care. So today's video is about the Aural Haematoma surgery of a dog. So let's get started with it. So before I show you the actual surgery video, let me brief you about what Aural Haematoma actually is. So Aural Haematoma is also known as Aural Haematoma or OT Haematoma. Aural is a term which is used for ears and OT stands for otitis, which is one of the conditions why hematoma is caused in dogs. Hematoma is a condition in which there is collection of blood or serum or even blood clot in between the skin and the cartilage of the ear flap. It may be restricted to one area or it may even spread to the entire ear flap. It is a condition which is commonly seen in pendulous ear dogs, that is Labrador, Dachshund, and even in a Desi dog. So let's now know what causes hematoma. Whenever there is some irritation to the dog inside the ear, like any insertion of foreign object or tick infection or otitis externa, as I said before, in that condition the dog will experience irritation and he will scratch or rub against some hard object or even shake that ear. And during this process, the tiny blood vessels and capillaries, they get ruptured and escape of blood takes place. This condition causes pain and discomfort to the animal, and he often bends his ear towards the side of the affected ear. On touching the ear, we can feel the fluid inside, and sometimes even the blood clot can be felt, and the ear is often warm on touch. Coming to the treatment of it, there are two ways in which it can be treated. The first one is by inserting a syringe and drawing the fluid out of it. But in this case, the chances of reoccurrence are more. So the second and the better option is to perform a surgery. And the surgery is performed under general anesthesia. So we make an incision and the fluid is drawn out, followed by suturing and antiseptic dressing. Now coming to the surgery. Before performing the surgery, it is important to keep the animal in the fasting state for up to 12 hours. And before starting the surgery, we give some injectables like atropine, xylazine, ketamine. So the animal is kept at the lateral recumbency and the affected ear upright. Also, cotton should be inserted inside the ear. Otherwise, all the fluid that will be drained out, it might enter into the ear canal. So that should be avoided. Also, when we feel the ear, when we touch the ear, we can easily feel the blood and sometimes blood clot as well. So while making an incision, we should try to make an incision over the blood clot so that the blood clot can easily come out and the fluid will easily follow it. Otherwise, we'll have to make a longer incision so as to cover the blood clot. So now I proceed with showing you the actual video of the surgery, and in case you are squeamish, if you do not want to see blood or surgery, then stop this video and do not see it any further. अगर आपको खून नहीं पसंद, अगर आपको blood नहीं देखना, surgery नहीं देखनी, तो आप इस वीडियो को रोक दें और आगे ना देखें. So these are the surgical equipments that would be required in this surgery. And he's a cute patient for today. He's an 8-year-old male Dachshund. His name is Tiger and his right ear is the hematoma ear. He will soon put under general anesthesia for his surgery. So we'll start by making an incision on the ear, and there comes blood and the blood clot, and it can be seen in the kidney tray. Also, the ear has to be cleaned from inside to clear out all the fibrin deposits. The ear can also be cleaned by flushing with normal saline followed by hydrogen peroxide. This is especially useful in case of recurrence hematoma cases. So the blood clot, it forms within 24 to 48 hours, and as time progresses, clot gets dissolved and fibrin formation takes place, leading to fibrosis and thickening of the walls, leading to cauliflower ear, but this condition is not so aggravated in this particular case. It is then followed by applying sutures. Suturing is done to eliminate the dead space or to avoid pocket formation in which the fluid can accumulate in the future. and hence eliminating the chances of reoccurrence. This particular suture pattern is called through and through sutures. Suturing is then followed by antiseptic dressing, and that's the treated ear. The post-surgical care is antiseptic dressing so that animal does not damage his ears and the sutures are in place. Also, antibiotics are followed so that quick healing takes place. So that was it for today's video. If you like this video, give it a thumbs up and do subscribe to Vet Visit if you haven't. While subscribing, do hit the bell icon so that you're always notified when I'm on YouTube. Till then, take care of yourselves and keep loving animals like you always do. Ta-da!